Inhalation therapy in COPD has been shown to improve symptoms, reduce the frequency and severity of exacerbations, improve functional capacity and overall health, and reduce risks of systemic side effects. However, nebulized therapy has traditionally been a secondary treatment, implemented usually in a clinical setting, outpatient clinic, emergency room, or inpatient setting, or for those with end-stage lung disease who might struggle to use handheld inhalers. But over the past few years, more nebulized medications have become available for the treatment of stable COPD, including long-acting bronchodilator options such as long-acting beta agonist, LABA, and long-acting muscarinic antagonists, LAMA. Their availability and ease of use has made nebulizer use more compelling, as long-acting therapies have been shown to be beneficial in control of COPD versus short-acting treatments. Additionally, the widely held belief of equivalent benefit from handheld inhalers has been questioned over the past several years. Perceived to be more portable, easier to use, and needing less maintenance, handheld inhalers are traditionally prescribed as the first intervention for COPD management. However, studies continue to document critical errors in the effective use of handheld inhalers, resulting in inadequate symptom control. Dry powdered inhalers, or DPIs, require a high peak inspiratory flow rate and breath holding, which cannot be achieved in patients with severe COPD. Metered dose inhalers, or MDIs, need dexterity to operate the device, which can be difficult in individuals with cognitive dysfunction or with neurological or musculoskeletal disorders, such as tremors or arthritis. These coordination challenges are somewhat reduced by soft mist inhalers, SMIs. But a recent meta-analysis demonstrated that SMI device use errors occurred in roughly 6 of 10 patients. When considering the appropriate delivery system for COPD medication, the Gold Report notes that selecting the optimum delivery system is essential to ensure patients gain maximum benefit from inhaled therapies, and continues, the final choice should be made jointly by the prescriber and the patient, taking into account device attributes and the patient's abilities, goals, and preferences. Shared decision-making has been shown to improve outcomes for patients with asthma, and is likely also to do so for patients with COPD. Nebulizers aren't trouble-free. They're less portable, require proper cleaning, and typically take longer to use. But recent advances in technology continue to mitigate these issues. Recent trials suggest patients prefer nebulizer therapy based on their perception of symptoms and their confidence of medication delivery, and nebulizer therapy may decrease the likelihood of hospital admissions.